So we are now in the macroscopic anatomy, chapter 4, or for this part 3, which is arthrology, and this is part 1 or the introduction. So when you say arthrology, this is derived from the Greek words arthros, which means joints, and logos, which means study. So this literally means study of joints. So joints or articulation is a union or junction between two or more bones of the skeleton. Now, we have several classifications of joints. The first one is the functional classification, and this is divided into 3. So we have immovable or synarthrosis joint, a fibrous union allowing little or no movement. So examples of these are your sutures found in the bones of the skull. So your intranasal suture, frontonasal suture, the maxilla, those are examples of sutures of immovable or synarthrosis joint. The second one is slightly movable or the amphiarthrosis joint, which allows only slight motion, the post bones being connected by fibrocartilage. So examples of these are your vertebral bones. So if you can recall your exercise number 3, the fibrocartilage of the intervertebral discs. So that's a classification of this joint. That's an example of this joint, amphiarthrosis. Next, we have the freely movable or the diarthroidal joint. So this permits relatively free movement. So hip or shoulder joints are an example. The second classification of joints is the structure. First, we have the fibrous joint, which is functionally a fixed immovable joint. The bones are united by a fibrous tissue allowing little or no movement, and these are often temporary joints that would later ossify in a process called syntosis. So examples of this structural classification of fibrous joints are the sutures, syndesmosis. So examples of this is attachments between the costal cartilages in the costal arc and the interosseous membrane between the radius and the ulna in the carnivores. And lastly, we have the gomphosis. It's actually spelled as G-O-M-P-H-O-S-I-S, gomphosis. So make the necessary corrections. The name for the implantation of the teeth into the alveoli of the jawbone. However, this is not a true joint since the teeth are not part of the skeleton. Another one is the cartilaginous joints, a joint united by either fibrocartilage or hyaline cartilage or even both. And they're classified into 2, the primary cartilaginous joint or synchondrosis, and the secondary cartilaginous joint or fibrocartilaginous joint or symphysis. So synchondrosis is a temporary joint made up of hyaline cartilage. Examples of this is the epiphyseal joint plates, which allow growth of the bone, then ossify as the animal matures, eliminating the joint. You also have the costochondral junctions. However, this one will persist throughout the animal's life. So synchondrosis will eventually become syntosis. Example is the cartilaginous, okay, this is that one I've mentioned. And then we have the fibrocartilaginous or symphysis. So the bones are united with fibrocartilage and possibly hyaline cartilage. Although they may or may not ossify with age, they always limit the joint's motion. Example of this is the amphiarthroidal joints. And examples of these are the pelvic symphysis, joints between the sternebrae and the sternal bodies. Then lastly, we have the synovial joint, which is movable, thus classified as diarthroidal. So characterized by its mobility, joint cavity, articular cartilage, a synovial membrane, and a fibrous capsule. So parts of the synovial joint, they have so they have the joint capsule, which is made up of 2 layers surrounding the joint. It's made up of an outer fibrous layer and an inner synovial membrane. So the fibrous layer is also known as the capsular ligament. It's made up of white fibrous tissue and yellow elastic fibrous layer at the joint capsule. It's attached to the periosteum on or near the margin of the articular cartilage, and thickness will vary from joint to joint and within each joint. The synovial membrane is forming the inner lining of the fibrous layer. It is highly vascular, nerve-rich, and produces a synovial fluid. The membrane may extend outside the fibrous layer to communicate with a synovial sheath or form a bursa under a tendon or ligament. So this is how it looks like. So this is an example of synovial joint. So this is the synovial capsule or joint capsule. So you have here the synovial membrane, which is the inner one. And the outer one is what you call the fibrous layer. Then the synovial fluid. This is a viscous liquid produced by synovial membrane to lubricate the joints and supply nutrients and remove waste from the hyaline articular cartilage. The articular cartilage is translucent bluish tinged cartilage, usually made up of hyaline that covers the articular ends of the bones to reduce the effects of concussions and frictions by its compressibility, elasticity, and smoothness. Varying in thickness between and within joints, the cartilage is the thickest in its area of highest pressure or friction. Synovial fluid supplies nutrients and removes waste products due to having no vascular or nerve supply. So you have here the articular cartilages here. So if you're fond of eating, eating because it's cold right now, or drink bolalo or puchero, you can see the bluish tinge on those bones. So that's a hyaline cartilage, and that is the articular cartilage. Next, we have the ligaments. So these are strong bands of white fibrous tissue uniting bones that function to keep joint surfaces in apposition. So usually inelastic and may be intracapsular, meaning it's within the synovial joint, or extracapsular, which is outside the synovial joint. Then we have the joint cavity, which is a unique feature of a synovial joint. It is little more than a potential space containing a trace of synovial joint. And lastly, we have the meniscus or disc, a plate of fibrocartilage partially or completely dividing a joint cavity. This allows a great variety of motion and alleviate concussion, and they are only found in the stifle and the temporomandibular joints. So when you say stifle joint, it's on the knees, and when you say temporomandibular joints, it's shared by the temporal bone and the mandible. Why do you think these are the parts that have the menisci or discs? It is because in the stifle joint, remember the hind legs, even if our animals are are walking on all four legs, the hind legs will always be the one that bears most of the weight of the animal. And when they run or when they jump, the hind legs will also absorb as the shock absorber. And because of its weight, it's bearing most of the weight. It needs the cushion in between the femur and the tibia in order to absorb the shock from the jumping and the running. So that's the reason why there's the meniscus there. Someone of great power put that put that meniscus there. How about on the temporomandibular joint? Why do you think they have it? They don't have it on their elbows. It is due to the fact that every time the animal chews its food, there's actually a heavy friction between the mandible, particularly the condylar process, and the mandibular fossa. So again, it provides cushioning. So there's a lot of friction going on every time we talk, or every time we chew our food. So any mouth movement will actually have friction. So there's the meniscus there. It's being placed over there just to absorb absorb the friction, just to lessen the friction actually. Now we go to the bursa, which is a sac-like structure found between the different tissues, which reduces friction between these tissues. They resemble a synovial joint in that its walls consist of connective tissue lined by a synovial membrane. Its bursas are located between skin and bones, tendons and bones, muscles and bones, ligaments and bones. Then we have the synovial sheath, a structure similar to a bursa that is wrapped completely around a tendon, and it reduces friction between the tendon and underlying bone. Clinical anatomy. A joint formed in an unreduced or unhealed structure having all the structures of a synovial joint. Excess synovial joint, since synovial fluid in healthy animals is minimal, the amount of fluid indicates the state of health of the joint. Luxation or dislocations, articular separations, usually due to injury or degenerative changes, may be caused by predisposing factors. Bursitis is inflammation of the bursa. Now we go to some classification of synovial joints. They are classified according to number of articular surface, classification according to their movements, and movements of the synovial joints. So when you see number of articular surface, we have simple joint wherein there are only two surfaces that is enclosed in the joint capsule. Example of this is the shoulder joint. So the shoulder joint, you have the glenoid cavity of the scapula and the head of the humerus. While the compound joint, you have more than two articular surfaces enclosed within the same joint. So example of this is the stifle joint, wherein you have the distal end of the femur, particularly its trochlea and the epicondyles. And then you have the proximal extremity of both the tibia and the fibula, and then you have the patella. Then we have the classification according to movement. So when you say arthroidal joint, two flat articular surfaces allowing a simple gliding or sliding motion. Most plane joints can move only in one direction, or we call it uniaxial. So example of this are the carpal, tarsal, small tarsal bones, cranial and caudal articulations between the vertebra. So the caudal and cranial articulation of the vertebra will allow you to extend and flex your vertebrae, while the carpal and small tarsal bones will allow you to move your wrist up and down. So when we go to your exams or when you go to your quiz, I will not accept common terms like plane, ball and socket, hinge. Use the medical terminologies. The second one is a spheroidal joint, or we call it the ball and socket. So a joint consisting of a spheroidal head fitting into a pit of socket, allowing a universal movement. So an example of this is the shoulder and hip joint. So you know already about that. Next, we have the hinge joint. It's uniaxial, so all movement at right angles to the bones involved. So it only involves flexion and extension. So it allows elbow joints. So example of these are your elbow joints and your interphalangeal joints. Then we have the trochoid or pivot, which allows rotation around a longitudinal axis of a bone. Example of this is the atlantoaxial joint, and if you can recall, the atlantoaxial joint is the one that gives you the no movement of your head. Ellipsoid or condyloid joint, a biaxial joint formed by an oval-shaped condyle of one bone fitting into an elliptical cavity of another bone. And lastly, you have the saddle or solaris joint, a saddle-shaped bone ends that meet at a right angle to form a saddle joint. Can rotate a little and move sideways and back and forth. Example of this is the base of the thumb, which is actually present in humans, and some primates, and your pandas. So when you say movement of the synovial joint, so you have flexion, extension, dorsal and ventral flexion. So that's the bending the spinal column dorsally or ventrally that is due to your cranial and caudal articular processes. Abduction, adduction, circumduction, rotation, and universal. So next up, we have another slide for joints. So if you do have questions, please do ask away.